Bismillahirrahmanirrahim. This is the first presentation in GIT. This is a plain film showing the gastric rugae are seen at your left hand, and soft tissue opacification is seen at your left or right at your right hand, and at the same time the cardiac shadow is seen on the right. So this is a case of situs inversus totalis. The liver is here, the stomach is there, and this is the heart. Here is a plain film for the urinary tract showing abnormal bone density at this region. In such cases, consider prostatic deposits or other types of metastasis. This is a plain film showing multiple rounded shadows in the pelvis, not going along the course of the ureter. You know all that the course of the ureter is descending along the transverse processes of the lumbar spine and then along the sacroiliac region, then curves with the concavity of the pelvis going to the bladder. These are not curving and they are not ovoid, they are rounded. These are the typical appearance of philibuli, and if you see any of them, you will find some central lucency inside. So these are philibuli. Here is the plain film, and in the plain film we have a small opaque shadow there along the course of the ureter, so it could be a stone, and the patient is complaining from his left side pain. Further assessment with intravenous urography revealed that this kidney is obstructed at the region of the pelviureteric junction, and this one is not a stone. So not all opaque shadows in the pelvis are stones, and not all patients with renal pain or colic are belonging to stones. Here is a soft tissue tumefaction coming from the left side and going this way, displacing the gastric rugae to the right. Any soft tissue opacification is coming from the left side and capped by the diaphragm, and the line of extension or the line of the tumefaction, the axis, is going to the right lower quadrant, is a spleen. So this is a large spleen, and usually such a large spleen is seen in lymphoma. Here we find something nice. We can see that there is a pedicle with no body, so this is a hemivertebra, and there is some scoliosis at that region, and there is definite spina bifida here. So you have spina bifida and you have hemivertebra. So long you find some changes in the vertebrae, you should be aware that this could be communicating with other, or associated with other congenital anomalies, including anomalies of the urinary tract and anal region, and if young, tracheoesophageal. So tracheoesophageal, renal, anal, and vertebral constitute entity with usual associations. If you find renal anomalies, search for vertebral. If you find vertebral, search for renal, anal, and tracheoesophageal. In this case, you find a soft tissue tumefaction here crossing the upper abdomen. So, going back to our principle, vertebral anomalies is usually associated with either tracheoesophageal in young, or renal in older age, or anorectal in the young. So this is horseshoe kidney, soft tissue shadow crossing the vertebrae at the upper abdomen. Now this one is an IVP with marked displacement of the urinary bladder here and there. So there is soft tissue tumefaction in the pelvis, being so smooth and semi-round. Tumefaction is filling the pelvis, and the ureters are displayed apart here and there. Please consider dermoids. Dermoid cyst can reduce such an appearance. This one is an IVP showing upward displacement of the left kidney. The axis is still there, but the kidney as a whole is displaced up, and the ureter is indented in this area, and indented is in this area, as well as it is displaced outward. This is a typical appearance of a retroperitoneal mass, and retroperitoneal mass with bossy outline should be lymph nodes. Here is a plain film. Of course, so long this is a fluid level, so this is erect, and we have here 1, 2, 3, 4, 5, 6, 7. So there are more than 3. If you have more than 3 fluid levels, or diameter more than 3 in more than 3 loops, that means, or more than 3 loops seen in the film, 3 levels or 3 loops or 3 centimeter diameter, more than 3 centimeter diameter, this is intestinal obstruction. This is a transverse colon, and here it is reaching into the pelvis. That's called redundant colon or dolicho colon, and this is the cecum reaching into the pelvis, and this may raise abnormal symptoms if there is appendicitis or something like that. This is an appearance which is non-specific, could be due to constipation. Here we have an intestinal loop going into the scrotum, and another loop here going to the scrotum, So this is typical appearance of bilateral direct inguinal hernias. This is the typical appearance of fecal material. In constipating patients. And this is air delineating the right collecting system. This could be due to iatrogenic maneuver, could be iatrogenic due to any maneuver. And could occur in some cases of diabetic urinary tract infection. Here, this is the urinary bladder with the air outlining within the wall, because it is trapped within the wall. If free, it will go out. This is emphysematous cystitis. Here in this case we have metallic shadows here and there, which are not typical for stones in location or direction of their axes. So these are not stones. And we have here a fluid level. So what is the relation between this and that? If a patient underwent a barium enema for diverticular disease, barium may be retained within the diverticula for long time. So this represents barium within the diverticula. Okay, and this a fluid level means that there is a pericolonic abscess. So this is diverticular disease and this is peridiverticular abscess. In this one we have small scanty intestinal loops, but there is soft tissue tumefaction of the whole abdomen, no dilatation of loops, and they are all centered in the middle of the abdomen. This appearance could be seen in ascites. In this one we have some scoliotic deformity, likely degenerative, and here there is paravertebral faint calcific shadow, which is branching and giving one here and one there. So this is a calcific aortic aneurysm. In this IVU, we will not be taken by this obstruction. There is obstruction, and the obstruction is limited by the pelvis, and being of such an appearance with marked dilatation here, which would consider a stone in the pelvis, not a pelvic junction obstruction, because in pelvic junction obstruction expect bulge of the inferior aspect of the pelvis. Bulge of the inferior aspect of the pelvis. So there is obstruction here, and there is a possibility of a stone in this area. But what is new in this one? There is definite osteolytic lesion involving the left hip, and usually in old age this is due to metastatic deposits. If you follow this ureter, you will find it elevated. It should be coming this area, but here it is elevated. the elevated ureter should raise the possibility of prostatic enlargement. This case represents the cumulus cloud. This is a plain film with the cumulus cloud, the clouds of the clouds accumulating or gathering together in the kidney, opacification, patchy opacification, which are not following a renal collecting system. And also there is calcification of the ureter. Of course, calcification of the ureter is either at TB or bilharziasis, and the calcification of the renal bladder, if patchy and amorphous in this way, is usually due to TB, but other lesions could be due to perirenal hematoma calcified, and this is called beige kidney. So we agree that this one is either or TB or bilharziasis, and this one is either or beige kidney or TB. So what is common in both is the TB. This is TB, and what supports us is the problem in the left hip. The left hip is collapsed with pseudoarthrosis, and this is bad healing, and TB is famous with this bad healing. Cystic changes of the bones are usually seen in TB. Cystic changes of the bones. Here there is the superimposed multiple shadows of calcific fibroids. And calcific fibroids are usually giving mottled appearance, mottled appearance, the same which occur in pancreatic calcifications and lymph node calcifications. Both can be like this. More than one are denoting an old age female with multiple calcific fibroids, and some calcification there could be could be gallbladder stones. This is a plain film with the what we call it wandering clips. While doing the lab coulis, this may fall down, and these are called wandering clips. Now this is a swallowed ring. A baby swallowed this ring, and this well seen localized within the gastric fundal gas. Somebody else was accused for this, and this one shows the bag of sweets malingerers are using sometimes to get out of the army, that they have gallstones, something like that, and these are the bag of stones just put on the skin. This is an example of an IVC filter. Thank you.